want to ask them if they have a history of heart disease, stroke, lung disease, diabetes, kidney disease, blood clots, or bleeding disorders, and any past surgeries. In addition to that, you want to ask them about their social history, and that includes smoking, cigarettes, cigars, vaping products, alcohol or drugs, including marijuana. What type of housing do they live in? For example, if they live on the first floor, if there's stairs, if they live in an assisted living or a nursing home. Do they have support in their house? If not, is there anyone that can help them if needed? Include family history of aneurysms, clotting disorders, connective tissue disease. You want to ask the patient if they have any loss of vision in one eye or a feeling of a shade being pulled over an eye. Also ask about any numbness or weakness in any of their extremities. This will indicate a stroke or a mini stroke.
All right, so we're going to start with a basic neurological exam. I'm going to look in your eyes with a light.
We will be assessing for cranial nerve functions. We want to look for dysarthria.
Okay, I'm going to have you look forward at the wall, pick a spot. I'm going to shine a light briefly in your eyes. Okay, all right. Just another little light. Okay. Now I'm going to have you follow my finger with your eyes.
Have them raise their eyebrows. Close off their eyes tight and open them. Smile and puff out their cheeks. After, have the patient stick their tongue out, left and to the right. Put your hands on both of their shoulders. Have patient shrug up and down and push against your resistance. Assess for strength in the upper extremities, and that includes the bilateral elbows against you, and also have them squeeze their hands as hard as they can. You also want to assess for bilateral bruits in their carotid arteries. After, you want to assess the upper extremity pulses, brachial pulse and radial pulse bilaterally for rate, regularity, equality, and strength. And assess for capillary refill, sensation, any numbness and tingling, and temperature. You want to ask them about chronic mesenteric ischemia, if they have any unexplained weight loss, pain after they eat, bloating, nausea, vomiting, or diarrhea. You will also auscultate the abdomen. Palpate the abdomen and assess for pulsatile mass for an abdominal aortic aneurysm. Then you want to assess for lower extremity arterial disease, peripheral arterial disease. You want to ask the patient about claudication, breast pain, ulcers, wounds, neuropathy, exam for lower extremity aneurysms in the popliteal artery. Some questions you want to ask: do they have trouble walking? Muscle cramping or aching in the buttocks or the legs with walking? And is it relieved by dangling their legs? You also want to look at their legs and assess for color, skin changes, edema. Where does it start? Where does it end? Ask them if they have any numbness or paralysis. tingling. You want to assess their motor and their strength bilaterally by pushing down like a gas pedal and pulling up, dorsiflexion. Wiggle their toes, assess for capillary refill, looking in between the toes for any wounds. You want to look at their heels for any wounds or discoloration. Cyanosis. You also want to look at the color of the lower extremities. Is it white? Is it red? Is it blue? Also take a look to see if they have hair on their calves. Is it shiny? Dryness? These could be signs of arterial disease. You will assess by a Doppler with gel. You want to assess if it is triphasic, biphasic, or monophasic.